temporal nerve at the neck of the mandible. The lingual nerve is related to the third molar tooth, and in extraction of third molar tooth one has to be careful not to injure this important lingual nerve. Next is the inferior alveolar nerve, which passes through the mandibular canal and exits out through the mental foramen on the outside. Before the inferior alveolar nerve enters the mandibular canal, it gives a branch which is known as the mylohyoid nerve, which runs in the mylohyoid groove to supply the mylohyoid muscle and the anterior belly of digastric. At the concave notch above, between the coronoid process and the condyloid process, is the masseteric nerve, which supplies the masseter muscle. These are the nerves. Now lots of vessels are related to the mandible. These are facial artery. Facial artery is a branch of external carotid artery. It is seen on the inner surface of the mandible, where it makes a loop, and then it is seen at the antero-inferior angle of masseter, where it runs on the in between the facial muscles, and at the lower border of mandible, an antero-inferior angle of masseter muscle, it is palpable, and it is known as the anesthetist's artery. Next is the external carotid artery, which enters the parotid gland and divides into a superficial temporal artery, which accompanies the auriculotemporal nerve, and a maxillary artery, which enters the infratemporal fossa. The mylohyoid vessels run in the mylohyoid groove. The mental vessels are seen from the mental foramen. The inferior alveolar vessels enter the mandibular canal, branches of maxillary artery. The masseteric artery runs in the concave notch. This is also a branch of the maxillary artery. The salivary glands are also related to the mandible on the posterior-superior part of lateral surface of the ramus, and also on the deeper aspect of the mandible is the largest salivary gland, the parotid gland. Also enclosing are some of the lymph nodes. The submandibular gland lies below the mylohyoid line, also enclosing the submandibular group of lymph nodes, draining the lateral aspect of the tongue. Above the mylohyoid line lie the sublingual salivary gland. The lymph nodes present have been said. They are preauricular in relation to parotid gland, submandibular in relation to submandibular gland. The fascia. Fascia, the deep cervical fascia, is related to and attached to the lower border of the mandible. Pterygomandibular raphe is attached behind the third molar tooth, and actually it gives origin to the superior constrictor muscle and buccinator muscle. The sphenomandibular raphe attached to the lingula of the mandibular foramen, and it is a remnant of first arch. The stylomandibular ligament is attached to the angle of the mandible. It is not related to any arch, but it is a thickening of the deep cervical fascia. Joints in relation to mandible. There are 16 joints with the teeth. These are gomphoses. Fibrous joints, the two temporomandibular joints formed by the head of the mandible and symphysis mentae in the center. The muscles of first arch are related to the mandible. These are 4 muscles of mastication: the lateral pterygoid, the medial pterygoid, the temporalis, and the masseter, and anterior belly of digastric and mylohyoid. Out of 8 muscles, 6 muscles are inserted into the mandible bone. And there are other muscles of the second arch, muscles of facial expression, and the buccinator muscle. The bones of the skull show numerous foramina for the entry and exit of various structures. These are very important from examination point of view as well as clinical point of view. The foramina in the anterior cranial fossae are the groove for the superior sagittal sinus, it begins in the anterior cranial fossa and runs up in the skull cap, the foramen cecum, present between the frontal crest and the crista galli. It is usually blind, but it may have an emissary vein from the upper part of the nose to the superior sagittal sinus. The anterior ethmoidal foramen, the anterior ethmoidal foramen gives passage to anterior ethmoidal nerve and vessels, whereas the posterior ethmoidal foramen only gives exit to the posterior ethmoidal vessels. The foramina of cribriform plate of ethmoid give entry to 10 to 12 olfactory nerve rootlets. This is the first cranial nerve. Behind it is the optic canal, which gives passage to the optic nerve, which is the second cranial nerve, and the ophthalmic artery, which is a branch of the internal carotid artery. The middle cranial fossa in the middle shows a hypophyseal fossa for lodging the hypophysis cerebri. On the side it shows superior orbital fissure. Below the medial end of superior orbital fissure is the foramen rotundum, through which the second division of trigeminal or maxillary nerve passes out. Behind that is the foramen ovale, through which the important mandibular division of trigeminal nerve passes. Also passing is the accessory meningeal artery, lesser petrosal nerve, and an emissary vein. So the mnemonic is male, M-A-L-E. Behind foramen ovale is foramen spinosum, through which the middle meningeal artery enters the cranial cavity, and there is also a meningeal branch of mandibular nerve. Behind that there may be an emissary sphenoidal foramen connecting the cavernous sinus with the pterygoid plexus of vein. Medial to that is the foramen lacerum. This aspect of foramen lacerum, the internal carotid artery and nerve plexus pass across its superior end. This foramen will be seen again in the inferior aspect, and occasionally a meningeal branch of ascending pharyngeal artery an emissary vein from cavernous sinus passes through it. The figure shows obliquely directed superior orbital fissure and its contents. It is divided into three parts: lateral, middle and medial. Through the lateral part,